And I think that's an important point to make. However, we are not beyond the capacity of the healthcare system to handle it at this point. And you want to stay below that so that we don't have to make difficult choices about, who ends up on a ventilator or not, which people in some places have had to do. So you want to stay under that so that it's within capacity of what the medical services can handle. And the way to do that is to continue with the measures. And I just want to say, it is not easy to do. It is not easy to be distant from your family and friends and to only go out when it's necessary, with schools being closed, etc. But it's really, really important.
Yeah, I think that's a good point to keep in mind, that we need to stay under capacity of the medical facilities, and that's why we have to continue to take these measures. And all the questions coming in, a lot of them, when at this point they're directly related to the virus itself, are about testing. And could you speak a little bit to testing and why it's been so difficult to get access to testing?
Sure. So at this point, testing is mainly being reserved for people who are very sick, as well as healthcare workers who may be exposed, and that too, it's being done quite sparingly. And the reason is very simple. We simply do not have enough tests available. So it's a matter of prioritizing who absolutely needs to get the test. And, in best case scenario, when enough testing is available, everybody who needs it should get it. Everybody who wants it should be able to get it. But we are nowhere near that right now. There's many different reasons for it. One is capacity, the materials. We're just not at that point yet. Now, I believe that a rapid test will become available shortly. It's the 45-minute turnaround. I'm hoping by next week locally, but we're not there yet. Okay.
Do you have any sense, and everything's moving so fast, so I understand if you don't, is if that rapid testing becomes available, would that change the protocol at all? Or we're still going to be at the point where we just have to keep calling our primary care physician, call the Department of Health, or call the Geisinger triage line in order to set an appointment? Do you think that will likely maintain, like, if they won't have enough to open up just a drive-through that anybody can come through?
Yeah, I don't think we're going to go to the drive-through scenario right away, but that might change in the next few weeks. I don't know exactly when, though, because it'll depend on, what infrastructure is set in place, and frankly, availability, just the sheer numbers.
Right, the availability of the test kits themselves.
Correct.
The biggest, right. And that's not something that you just have in a lab, just sitting around a large volume of test kits specific for COVID.
Indeed.
Okay. So I wanted to, while we're talking about it, the number for the Department of Health to call and talk through your symptoms is 1-877-PA-HEALTH, and the Geisinger Nurse Triage line 570-284-3657, 284-3657. I wanted to also reiterate that if you are uninsured, you should please still seek care. There are programs in place to make sure that people are getting the care that they need, regardless of whether they are insured or not. Dr. Shetty, is there anything that you think that we might be needing to do in the city that we haven't been? I know you and I talked earlier today about, I put out recommendations last night about spacing in our retail stores, and really pleading with the faith community to find remote ways of worshiping. Is there anything else that you've identified that you might implement here, or you've seen other places that could help us?
No, I think at this point, you hit the nail on the head. I think social distancing and all the mechanisms to put it into place. So supermarkets are doing different things, like laying out, a cart length distance from each other is approximately the distance to stay away, spacing out how lines are formed, letting in only a certain number of people into the store at a given point. So those are all sensible measures to put in place, along with frequent wipe downs and cleaning carts, making sure you're masking when you're out in public, especially when other people are around. And the reason all this becomes important is because of what we call asymptomatic spread, which is that we think that this virus may be spreading even though people aren't exhibiting symptoms.
Yeah.
There's another term people may have heard, which is pre-symptomatic, which is for about 2 to 3 days before people have symptoms, they may be shedding a lot of virus, which could infect others. So those are the things to keep in mind. And again, you may not be at risk, but somebody else, you may not be at high risk for dying of it, but somebody else you come across might be. Right. So that's the important thing to remember.
Okay. Oh, it's a lot still. And as we go into what I know is a very important week for many people in our community who are of the Catholic and Christian faiths, this is a tough week for a lot of reasons, but for the reasons that Dr. Shetty just outlined, we're asking people to find those alternative ways to celebrate and practice your faith this week, because it really is about your neighbors and your loved ones. And even, it's possible, right, Dr. Shetty, I could have or have had this and never known it, right?
Correct.
Yep. So, Dr. Shetty, thank you so much. It's been so wonderful to be able to connect with you every few days to just get updates. And I appreciate you joining us today to give an update from an expert. It is very helpful to the city.
Thank you for having me.
Okay, thanks. All right. Thank you to Dr. Shetty. I wanted to just talk about those new proclamations from last night. I issued 2 proclamations, one recommending that retail stores limit the number of customers at any given time to 5 customers per 1,000 feet of public or sales floor space. And then a recommendation urging those community-based organizations or faith organizations to not be holding gatherings of people at this time. Did see some reports this weekend of that happening in a couple places in the city, and it's upsetting because we really can't be bringing our congregations together right now, unfortunately. So please do try to find those alternative means, and we really deeply appreciate everyone sacrificing so much right now. I know this is a time that people need their resources, but if you can find those alternative means, we very much appreciate it. And once we get through this, we can hopefully go back to as normal as we possibly can. So those were pieces that we did last night, and I wanted to reiterate that the reason for doing the retail pieces is for customers to feel confident when they go out that other people are going to be respectful, and we have the spacing available around us to be able to respect social distancing. It's really also for our business owners and their employees to help them feel safe, to help them feel confident that there's enough social distancing at the stores that they're working at. I know from personal experience how difficult it is to be a business owner right now. It's very, very, very stressful. There are many difficult calls. Things are changing every single day on what the guidance is. Now, all of a sudden on Friday night, it was everybody's got to wear masks. Well, all of it, I think Joe Fazula on his Facebook said for Garrity's, I can't just wave a magic wand and produce 1,100 masks. So these things take time. It's very difficult. The business community, I am thankful for everybody being thoughtful and patient and working with the city, working with the state orders, and working their best to protect their employees and their customers. Let's see. Wanted to talk to you guys quickly before we get to questions about how to volunteer. We've got some more volunteer opportunities. The City of Scranton is so wonderful about reaching out to each other, and I really am excited to be able to offer some more opportunities. So the Weinberg Food Bank needs volunteers to help pack boxes, If you go to ceopeoplehelpingpeople.org, again, ceopeoplehelpingpeople.org, you can sign up to volunteer to pack boxes. That will be really helpful, as we've seen an increase in need for food. For example, right now, there is a very long line for the Friends of the Poor food drive that's at, or the picking up food at Scranton High School. The line is long, but it's 10 to 5, so there's plenty of time to get there if you need to get there. We thank the Friends of the Poor for stepping up, as always, to help feed our community. And in that same vein, with feeding our community, first, never be shy, never be embarrassed to go seek help. These resources are for you. We have a lot of folks that are out of work right now. Please go seek these resources. So Friends of the Poor is hosting right now as we speak, Scranton High School, 10 to 5 p.m. So another 5 hours to go there. So please go if you need some help for your family. There's no shame in that. Also, Thursday night from 7 to 8 p.m., the same phone number. We and Zoom and Facebook, our same structure. The city is, along with our city council, state legislators, local musicians and artists, we are hosting a virtual fundraiser for the Northeast Regional Food Bank. They're seeing such a huge increase in need, and we want to get them the cash donations that they need, because they're not accepting food donations. There's a lot that goes into accepting actual food. Right now, they just need the cash so that they can go out and purchase in bulk what they need and distribute that throughout the different entities, and directly to our neighbors in the community. So 7 to 8 on Thursday night, we'll send more information out, but it's, again, 7 to 8 Thursday night. You can watch on Facebook, or you can call into this same phone number. We'll be raising money for the food bank and try to make sure that we can keep these wonderful drives going. So I appreciate everybody doing that. In addition to volunteering, or excuse me, also volunteering opportunities. So Keystone Mission is looking for volunteers. That's keystonemission.org. You can go to volunteer at Keystone Mission. Meals on Wheels, you can call 570-346-2421 to learn how to help at Meals on Wheels. I know, at least as of last week, they needed help sanitizing their vans between use. So Meals on Wheels is taking those volunteers, 346-2421. United Neighborhood Centers also is looking for volunteers. You can call 570-346-0759, extension 109, and get patched into helping at United Neighborhood Centers. So again, United Neighborhood Centers looking for volunteers, 346-0759. Thanks to everyone who is also making masks for each other. There are ways to connect. You can drop masks that you're making at our firehouses as part of the Mask Bandits project, or you can go to Lackawanna County Neighbor Assistance Facebook page, or nextdoor.com is also a great resource to connect neighbors to match up who needs assistance and who can help. So that could be getting a mask to somebody, that could be getting some groceries to somebody, that could be medication, if potentially anything that you might be able to need. The nextdoor.com and the Lackawanna County Neighbor Assistance Facebook page. In terms of phone, dialing 211 is a way to get patched into these various social services, and that's a great way for you, a great number for you to call, 211, if you don't have the internet connection or capacity to go online. Another piece, of course, that we're hoping everybody knows is that we do need donors for the blood drives. So please donate blood, make an appointment at 1-800-RED Cross or redcrossblood.org. Okay, so one on the city government, we have our COVID-19 resource guide is available in hard copy in both Spanish and English. It's on our website, but it's also at the kiosk at the back entrance to City Hall on Dix Court between the firehouse and City Hall. If you want to go pick up a paper copy, or if you think you have somebody in your neighborhood that might find that useful, or if you're an organization that needs something and wanted to make copies, you could go down and you can park in the mayor's spot real quick. Happy for you to do that and pick up a copy of that in Spanish and English. We continue to ask you, if you see a business or some sort of organization that you don't think should be operating, please don't call 911. You can call 348-4101, or for code enforcement for construction or that type of work. If you have questions, 570-348-4193, or email scranton311@scrantonpa.gov. So we also had to, this crushed me. We had to cover the basketball hoops and take down the volleyball net at NAOG. Please use social distance when you're at the parks. It was really tough to have to do that. We were hoping not to. We were hoping people wouldn't play those team sports this weekend, but they did. So can't reiterate enough, please, no team games. Go for that walk with the members of your household. Keep that distance on the paths. Go throw the Frisbee with your kids, but please, no team sports. We just can't have that be happening. So wanted to go into questions now. And like we've been doing for a few weeks now, we're trying our best to answer your questions every few days so that we're in a communication with each other. Unfortunately, the technology doesn't allow us to be live asking questions on the Zoom, but I hope this is helpful. And I'm sorry that the Facebook isn't working today. We'll hope to get that back up and running, of course, for Thursday night's fundraiser and then Friday's town hall. But so with questions, wanted to cover what's coming in. Okay, so Diana said, I see a lot of families in the grocery store without masks. Can stores require masks and limit people? Families shouldn't go to the store together. Thank you, Diana. I agree that families don't, unless you aren't able to have childcare, please don't go to the store together. Please, if you need groceries for maybe your older parent, please don't bring them with you. I know they want to get out. We all want to get out more than we are, but it's really important to just go yourself, or with a child. If you're not able to find childcare, please please limit the number of people that you're taking with you. If you can wear a mask, please do. Masks don't have to be sewn like the one that I had at the beginning here. If you just use a bandana or a t-shirt for right now, that t-shirt fabric is fine, is what I've been reading at least. You can use those things as well. And that was what we made the recommendation for last night with the retail stores, asking them to limit the number of people at a time. It will be difficult for some stores to implement that, and I understand that. I understand that probably for some stores for the larger stores requires an employee to be tracking that. And I understand that's an added cost. And it's tough. It's tough for all of us. I appreciate the business owners doing that for us. And I understand, Diana, what your concern is. And we had the same concern over the weekend. So that's why we put that recommendation forth. Kevin also had a question similar. The church on my street held group services and did not adhere to ed social distancing. Can the city do anything? Kevin, that's a recommendation we put forth. I'm not going to order religious organizations to do something, but we can continue to urge that we cannot be having these group gatherings right now, that it's really, that's going to go against everything that we've all been working so hard to do, which is flatten the curve. As Dr. Shetty said earlier, we're seeing less of a steep uptick here than we might have. So what we're doing is working. We've got to keep that hill from not climbing, or not growing rather. Mary Kay asked, can you enforce social distancing when Scranton fire trucks or police cars drive by for birthdays? Families are gathering on the sidewalks. So my understanding was that the families were just the the families that live in a household were gathering. We want everybody to enjoy that, but it's meant for you to still keep your social distance between households. So if you can please keep that distance from the other families. You always can wave at your neighbors, but please don't be using that as an excuse to mingle and chat and get together physically close to each other. So Mary Kay, thanks for raising that, and we'll track that and really want people to be respectful. We're trying to do something fun. We're trying to give people a treat, especially our kids who are missing their birthday parties. So please keep that social distance if you're going to be outside. Glenda asked, will I enforce a curfew? So a curfew would be an absolute last resort. A curfew is a very intense and difficult thing to put on my police force. I don't see a need for a curfew right now. A curfew would be used, I think, for different scenarios than what we're in right now, at least at this point. I actually, with thinking about social distancing, if a store is open until 9 o'clock, I'd rather have a handful of people go between 8 and 9 than everyone go at the same time between 6 and 7, right? So I don't want to do a curfew. I don't want to put that on my police force. They are working around the clock as it is. And so I don't think a curfew is necessary. I don't think it's needed at this time, but I appreciate the question. And, there's no playbook to this, as we've talked about. Different mayors. I've been in touch with Mayor Cassatt in Hazleton. We were actually just texting about an hour ago. He and I have different approaches, but we're continuing to communicate with each other. I told him about our recommendation for retail stores. He talked about the curfew. We're bouncing ideas off of each other, but I don't think a curfew is necessary here in Scranton. And then let's see, why did it take so long to stop the Greyhound bus? All right, so mayors can't stop interstate travel. We know that's only the federal government can stop interstate travel. I was in touch with Greyhound for many weeks, and they were continuing to update me on their various protocols at Port Authority, giving out PPE on the buses, and then kept updating me on the numbers, which even when we first were in contact had already diminished substantially. By last week, there was just a handful of people once a day. But I realized that the community was really concerned about that happening, that bus service, and so did communicate with them overnight. I guess it was Saturday, and they agreed to curtail all service. So there's no Greyhound bus service to Scranton at this time. That's until further notice. I appreciate Greyhound working with us on that. I appreciate the feedback from the community on that. We're trying to listen to you all. I hope that this is a good example of that. Really trying to listen to our community and understand your concerns. And Greyhound was really did a good job. And they, as soon as I wrote the letter, they came back with a positive response. So I really appreciated that. Dave asks, do I need to get my car inspected? The expiration date for car inspections is now extended until May 31st, Dave. So you are okay there. Let me just check my phone for any other updates that might have come in. See if there's any. Oh, I guess we're not on Facebook, so you guys weren't able to ask live questions. I'm really sorry about that. We will upload this video to Facebook after, and there's, see, this is a good example. They're cutting my grass right now, which doesn't seem like to happen. Hello? Yeah. So there you go. There's one right now. I will find out about the lawn care situation. I don't see why we need the lawn outside of my condo complex cut right now. So I will run that up my chain and see what that looks like. So we've got a live question from the mayor herself on today. We'll get to the bottom of that. So probably one more thing we got to deal with, but that's why we're doing these, guys. This is why we're doing the town halls, to try to be answering questions and identifying issues. There's issues that come up all the time. We really, really, truly appreciate you for being engaged and caring so much about your community. The questions you ask help us inform different things that certainly inform our policy discussions of what we need to be doing. So we appreciate that very, very much. I could not end this tonight without saying thank you to all of our healthcare workers, all of their families, all of our first responders, our police, our fire, our sanitation workers, our public works folks, the guys in the garage making sure those garbage trucks are fixed every single day and ready to go out to keep our city clean. Truly appreciate everyone that is out there, continuing to do fire inspections as needed, things like that. We really appreciate our city employees and their families, and all of you out there, our business owners, our employees of businesses. Everyone's, for the most part, little group of people that please, please, please stop congregating at your local park and play basketball, but that kind of thing. So thank you to everyone so very, very much. I deeply appreciate you. We'll be back here same time, 12 o'clock on Friday. And in the meantime, you know, look at our Facebook page or our website, or the volunteer opportunities 211 if you need resources, and those websites I listed. You know, 1-800 Red Cross to donate blood. That's a great one to help. United Neighborhood Centers 346-0759, or Meals on Wheels 346-2421. Those are great places to volunteer. So thank you all for doing everything that you're doing. You know, your mask doesn't have to be fancy like this one that somebody made for me. You can wear a mask that's homemade, but it is best to wear a mask in public. So please do that. And we'll see you guys Thursday night for the fundraiser and Friday for the town hall. So thank you. Be well, Scranton.